Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. It's my privilege to be here with Jeff Glueck, CEO and co-founder of Salvo Health. Jeff, thanks for joining me today.
Great to be here.
Love getting the updates on what you're building. You're moving fast. You've built this company in the area of gut health, but I know there are interesting ramifications in chronic disease and chronic care management. Just let's level the playing field. What did you build?
So Salvo Health is helping bring wraparound care, including mental health and microbiome care and cognitive behavioral therapy and a whole host of other services to solve the epidemic of over 60 million Americans who face chronic GI challenges or gut health challenges. There's a lot of talk about gut talk and gut health these days on TikTok. It's rampant with our diet and stress and changes in our environment. That gut health problems are happening, and they're closely tied as well to the mental health epidemic in America. So about 75% of the people we treat also have anxiety and depression, which makes sense because their gut is messed up.
Just to step one step back, where are we at in this sort of obsession with gut health? You said TikTok. People are talking about, the health of my gut biome affects all these other things.
That's right.
Like, are we sort of peaking in a sort of a public understanding, or are we just getting started?
I think it's just in the first innings here of understanding this complex way that your gut and your brain talk to each other through the vagus nerve, and the microbiome is thousands of other species that live inside us. There are more cells in our gut than most of the rest of the body, and so it's just an incredible ecosystem. What people don't realize, I think, enough is how they eat and how they approach taking care of their gut affects their broader health. 90% of their serotonin, which is your happiness and your calm chemical, is made in the gut lining in these epithelial cells in a complex interaction with your microbiome. And so if you have IBS or other kind of so-called mid-acuity conditions, and of course Crohn's and colitis and some higher acuity conditions, you disrupt your serotonin. Anxiety and depression happens in 3/4 of cases, and it's a two-way street between the stress and the gut, and it's a vicious cycle. We can break that. I mean, our research and our practice now with patients is showing that around 80% of patients can get better start seeing major symptom improvements in 6 weeks on our kind of interdisciplinary program. It's fixable, but I think we're really in the first innings of what could be a precision medicine, whole health revolution.
Let's talk about the patients for a minute, because one of the things that really gets me about your company and other gut health companies is that you're tackling these folks with maybe IBS and Crohn's who, as we say, have been suffering in silence or have been marginalized, stigmatized.
Right.
Talk to me about that community that you're helping.
So you have to have empathy for there's over 60 million people with chronic gut problems. And when people get to our treatment, usually they've suffered from constipation, diarrhea, nausea, inflammation, vomiting, and other symptoms for 3 to 5 years. And 86% of patients we surveyed with chronic gut problems say they've been to doctors, but they're not better. They're not resolved. These are things that doctors, for the most part, don't have a lot of time to treat. So doctors, for the most part, aren't trained in nutrition or cognitive behavioral therapy or microbiome rebalancing. They don't have usually the staff or the time to do the follow-on care in a very personalized journey. Yeah. And people don't feel heard. I mean, one of the nice things for us is, each patient gets through our Salvo Health app, in addition to their main doctor, they get a nurse, a dietitian, and a therapist, in addition to digital programs every day, and they feel heard for the first time. Yeah. And IBS is one of the most common ailments in America, and it used to be called hysterical housewife syndrome by the male, because it's 2/3 women, it's younger women, they're gaslit, they're ignored, and they're stigmatized by the system. It's embarrassing to talk about this stuff, and so we're really giving the privacy of your own team over the 4 to 6 month treatment period, where you really get to know your team and they get to know you, and it's done very software enabled, so it's very affordable.
Interesting.
And we can talk about our new research on the cost of these patients that are underserved on the system, which is really high.
Yeah, tell me about that. How did you conduct the research?
So we contracted with the leading actuarial firm in healthcare, They ran a study for us looking at 9.5 million covered lives, and we asked them to compare IBS sufferers and IBD sufferers in total medical expense, all medical expense, to the to the average American, both commercial and Medicare. And the results that came back, obviously everyone knows Crohn's and colitis patients, IBD patients, are very expensive, 6 times an average. But what people don't talk enough about is there are 15 times more mid-acuity patients like IBS and the like, and those patients cost double the average patient. So instead of $7,000 a year TME, the cost of the system is over $14,000. And these are the mid-acuity patients. Because you know what happens? They don't get good care. They usually will get a colonoscopy or an endoscopy and told you don't have colorectal cancer. Good news, 28-year-old sufferer, you don't have cancer. Come back in 9 months, here's a pamphlet. That's the care, the usual care today. Those people then end up in the ER, they end up going back to PCPs, they go to different GIs seeking a different answer, they get new imaging, new studies, they're very expensive. They also have anxiety and depression and work, they're missing work and they're expensive in care. If we could address the problems, we could cut huge amounts of waste and the human suffering associated to it, and that's what we do. So it's an absolute myth that these mid-acuity patients are not high utilization. These 60 million people they're frustrated, they're suffering, and they're expensive, and they deserve solutions.
It's kind of a whole philosophical switch to really focus on the needs and costs of mid-acuity. We're talking about gut health, but I see that as a trend across the landscape, and to say like there are these needs just under the surface, or maybe that just didn't reach the level of urgent care or emergency yet, and yet they are potentially breaking the back of the system. They are also stopping people from living full lives.
That's right. That's right. And I think this is where the intersection of the gut health crisis and the staffing shortages in America hit. Because everyone here at HLTH is talking about the shortage of physicians, but also a shortage of nurses, shortage of psychotherapists in this country, right? And there's only about 100 gut-focused psychotherapists in the entire country. And there's 60 million sufferers. Yeah. So what we're trying to do is we're taking the very best experts in the field, and we're digitizing a lot of what they do and also enabling it through software, but then keeping that human touch of a dedicated team for support. And so the average patient in the Salvo Health getting treatment is getting 3 hours of care a month in the app. They're opening it 9 times a week on average.
Wow.
But it only because of all of the software and technology. I mean, I'm a former CMO of Travelocity and CEO of Foursquare, as you know. Like, we're doing 3x is the ratio. So it takes less than an hour of nurse and therapist and dietitian time to provide 3 hours of care, because of how much we've automated the care. And so we're tripling the workforce, essentially. And we're taking these needy patients off the nurses and the physicians at the hospital. They don't have time for that follow-on care. We face, a real shortage, 15,000 GIs in this country, 60 million sufferers. So, do the math, right? You need tech solutions, and that's why Salvo Health was formed.
So what's next for Salvo Health? Last time we talked, about a year ago, you had just raised $10.5 million. You've been working on this scaling up, expansion. So now 2023 in the fall, kind of what's the next big move?
So we have won some big hospitals and multi-state GI private equity-backed clinics, but we need to take this to many more provider and health systems. So our product, which is RPM CCM, comes into a GI practice or into a GI department, and then helps those patients who've had a workup, a scope, and 99% of them are negative. We then work with the doctor to provide the wraparound care with the team that we've been talking about, and it's profitable for the health system. But on top of that, after that, we want to move to helping primary care on GI, working with these local doctors, because we did a control and treatment study. When you put people into this kind of continuous telehealth care, daily support, we saw 79% reduction in GI-related ER visits.
Wow.
and we saw 42% reduction in GI-related primary care visits, because now these people have support. They have daily, support, and so they're not ending up in the ER. They're not bouncing around the system at double the cost. So as we spend the next year rolling out with health systems and GI providers, we're also looking to expand to be available to support ACOs that are thinking about population health and how do we get people who need scopes, who are high acuity, to the front of the line with these scarce GI departments and GI private practices, but also take the burden of these needy lower acuity patients off the doc's hands. And it's profitable for everyone, and it saves the payers money. So it's kind of one of these triple wins. And most importantly, 80% of patients feel better within 6 weeks. And that's just the start. So that's kind of where we're going. And
is it challenging to stay focused on your niche, gut health, knowing that once you've got a relationship with a patient, they've got all these ancillary needs and everything, just like the gut, everything is so connected?
Well, our care model already looks at the whole patient. So when we're doing CCM, we're not providing the endocrinology care or the cardiology care, but we're doing care coordination with those other providers, and we are looking, when we're helping them with diet, we're taking into account their diabetes or their obesity. But where we are getting pulled, and this is something we're about to announce in Q4, so I'll pre-announce it to you, Logan, is that our GI departments are usually hepatology departments as well. And so GIs in America are charged with looking at liver scans. A quarter of the country, thanks to the obesity epidemic, has what used to be called fatty liver disease, but this is now called MASH. So it's hepatic steatosis. It's metabolically caused. You start to build up fat in the liver. It ends up, if you don't deal with it, as a liver transplant, and it's very serious. With the obesity epidemic, it's just getting worse. And so GIs are charged with treating and doing the diagnostics on this fatty liver disease or MASH. We just added to our clinical advisory board Dr. Mary Ranella, who wrote the national guidelines for fatty liver disease and renamed it MASH. She joined our all-star clinical advisory board, and we are launching a MASH program that will support GIs and hepatologists in caring for these MASH patients, which again is an epidemic right now, thanks to the obesity and diabetes epidemic. The liver damage is terrible in this country, and the solutions require wraparound lifestyle changes. So it's diet, it's stress, it's whole health, it's movement, it's sleep, it's GLP-1s in some cases, but GLP-1s alone don't work unless they're combined with behavior change, diet change, and particularly resistance training so you don't lose muscle mass and destroy your metabolism. So all of this we're launching too, but we are focused, unlike others in gut health, we are focused on helping providers deal with these problems.
Got it.
So our go-to-market is GI practices and hospital GI departments, and that's keeping us focused. What do they need? And they're asking us for this MASH program.
I love it. Well, Jeff, I could ask you a lot more questions, but that's the time we have. I appreciate that you are targeting this 60 million people that have been stigmatized, suffered in silence, and giving them the tools that they need, and also giving these providers, who have been frustrated themselves, right? The tools they need to help these folks. So appreciate what you're doing and for you stopping by.
Thanks, Logan.
All right, take care.